Hi, my name is SanJuana Gonzales, and I am doing a persuasive speech on ADHD and medications. By the end of my speech, you should be convinced not to medicate your child with ADHD before considering other options. Doing what is best for your child is not always easy, especially if you have a child with ADHD, but is medicating them the right thing to do? Ask yourselves this: are we as parents responsible for our child's ADHD? If you doubted yourself, then we can also be responsible for their methods of treatment. I will show you why it is not necessary to medicate your child that has ADD. I have done my research online and I have read articles on the subject, and I also have a nephew that was diagnosed at the age of 5. I will give you some options to consider before you decide on ADHD. I will also give you the side effects of the medications we are giving our children. Finally, I will show you examples of people that have overcome ADHD without medication. Okay, let's look here. Some options that we have before medication is lifestyle changes. According to Judy Bruin, she suggests better sleep, better diet, balanced diet for ADHD. She also said it's really good for fitness, like walking, jogging, bike riding, stuff like that. Another option you have is extracurricular activities. You can put your child in baseball, basketball, football, any outdoors activities. We also have therapy. There's therapy for your child to speak to another person that can give them some tips and stuff. We also have positive parenting. Some tips on positive parenting that I saw online are to stay calm, give your child the chance to make their own choices, realize that your child is not misbehaving on purpose, be persistent, also educate yourself on ADHD, that way you can help your child through their mood changes. Okay, now that you know the options you have, let me warn you about the side effects of the medications that your child could be on. For example, the negative effects that we have are for the prescription Focalin. There's a loss of appetite, weight loss, sleep deprivation, increase in anxiety. Also in Ritalin, there is nervousness, anxiety, insomnia, nausea. There's an increase or rise in blood pressure and heart rate. They have hallucinations, and sometimes they could be addicting. So is the cure worse than the problem? That's a good question to ask yourself. After seeing the side effects of the medications, I'm also going to give you examples of people that are overcoming ADHD without medication. And this is coming from Sports Stars Offer ADHD Hope Sunday Star Times 2012. We have Michael Phelps. He is an American swimmer and the most decorated Olympian of all times. He holds the all-time record with 22 gold medals. Michael Phelps was used swimming as a therapy to stop taking medications. A quote from his mother, she recalls that being told by one of her teachers, "Your son will never be able to focus on anything." Isn't that sad when our teachers give up on our kids? That's one thing that teachers shouldn't do. Okay, now we have Adam Creek. He is a Canadian rower who won gold in Beijing. He states that diagnosed at the age of 6, he believes anyone with ADHD can train their mind to channel their incredible energy, as well as good diet and his family support. Patrick Barkham, 2012. He found rowing to be an outlet to control his ADHD. And lastly, we have Felix Gonzalez, an average 9-year-old. He was diagnosed at the age of 5, and that's when he was put on Focalin. He seemed to be no different. Then they put him in sports. For example, they put him in baseball, then they put him in football, and then they put him in basketball. And they saw more change when he started doing sports than what they did whenever he was on medications. Okay, this boy that I'm talking to you about, he's my nephew. He's just an average 9-year-old. He spends the night at my house often. He's a little hyper. more hyper than the average child. But he's a growing little boy, and I wouldn't want him to change, and no medication is going to change that, because I wouldn't want him to change. Again, I say to you, doing what is right for your child is not always easy, especially if you have a child with ADHD. But is exposing our kids to drugs so young really the answer? I leave you with this to think about. Not even the doctors are sure about the long-term effects of the medications have on your child. So are we willing to take that risk for our child? Thank you.